Hello, friends. Today we are going to talk about integrated healthcare delivery with AYUSH and other indigenous system of medicine. Okay, so we are going to compare basically AYUSH and ISM along with allopathic or the modern medicine. So this is the a subject of your first semester of Masters in Public Health called the Health Systems Development. So as you all know, Indian system of medicine is a culmination of the Indian thoughts of medicine, which is considered to be a way of healthy living valued with a long and unique cultural history. Okay, so before understanding the entire concept, we need to understand few things. Okay, so as you know, that India has a tradition of the traditional medicine in India is a quite a long one. Okay, it's very very old. So अगर आप देखा जाए तो ट्रेडिशनल मेडिसिन को पहले हम डिफाइन कैसे करते हैं ये आपको समझना बहुत ज़रूरी है। और ट्रेडिशनल मेडिसिन से ही फिर आपको ये समझ आएगा कि आयुष के अंदर जो कंपोनेंट्स हैं, जिसमें आयुर्वेदा है, यूनानी है, योगा है, सिद्धा है, होम्योपैथी है, वो कैसे इंटीग्रेट करता है। तो पहले हम थोड़ा ट्रेडिशनल मेडिसिन को समझ लेते हैं। सो ट्रेडिशनल मेडिसिन का डेफिनेशन जो हम बोलते हैं वो इसको इस ऐसे डिफाइन किया गया है कि इट इज़ एन अमलगेशन ऑफ योर नॉलेज, स्किल एंड प्रैक्टिसेस। तो KSNP, ओके, कि हर जगह पे नॉलेज, स्किल और प्रैक्टिसेस बहुत इंपॉर्टेंट है किसी भी पैथी के अंदर। सो दिस इज एन अमलगेशन ऑफ नॉलेज, स्किल्स एंड प्रैक्टिसेस विच इज बेस्ड ऑन द थ्योरीज, बिलीव्स एंड एक्सपीरियंसेस। अब यहाँ पे तीन चीज़ें आती हैं। क्या क्या? थ्योरीज क्या है, उसके बैकग्राउंड क्या है, उसकी बैकग्राउंड इन्फॉर्मेशन क्या, बिलीफ सिस्टम क्या, बिलीफ सिस्टम लोगों से आता है, ठीक है, एंड एक्सपीरियंस। और जब बिलीफ कैसे डेवलप होता है, जब एक बार लोग एक्सपीरियंस करेंगे, विच इज इंडिजीनियस टू द डिफरेंट कल्चर्स, वेदर एक्सप्लिकेबल और नॉट यूज फॉर थेरेपेटिक। अब ये किन किन चीज़ों के लिए यूज होता है? इट वुड हैव बीन यूज फॉर थेरेपेटिक पर्पसेस, रेस्टोरेटिव पर्पसेस, प्रिवेंशन, डायग्नोसिस एंड मेंटेनेंस ऑफ द फिजिकल एंड द मेंटल हेल्थ। तो मैंने आपको जो बताया वो ये है कि ट्रेडिशनल मेडिसिन, अगेन आई विल रिपीट, इट इज़ एन अमलगेशन ऑफ योर नॉलेज, स्किल एंड प्रैक्टिसेस विच इज़ बेस्ड ऑन द थ्योरीज, बिलीव्स एंड एक्सपीरियंसेस indigenous to different cultures, whether explicable or not, used for therapeutic, restorative, prevention, diagnosis and maintenance of your physical and the mental health. Okay, अब यहाँ से ये चीज़ निकल के आती है। इसका मतलब ये है कि इंडिया, क्योंकि इतना, इंडिया की जो सभ्यता है वो हम कहते हैं 3,000 साल पुरानी है, ठीक है ना, इतनी इतनी पुरानी सभ्यता। तो दैट मीन्स इट हैज़ गॉट एन अमलगेशन फ्रॉम द डिफरेंट कल्चर्स। द ऋषि मुनियों से आयुर्वेदा आया, उसके बाद में जब मुगल पीरियड आया इंडिया के अंदर तो उस टाइम पे यूनानी मेडिसिन बहुत पॉपुलर हुई। सो इट हैड बिकम अ पार्ट एंड पार्सल ऑफ द इंडियन ट्रेडिशन। And these systems, as they are locally, they are basically recognized globally for complementing the disease prevention, treatment and the generic health maintenance. So it is very very important. और अगर देखा जाए तो दीज फिनोमेना, ओके, तो हम जैसे आयुर्वेदा की अभी बात करेंगे तो इसको हमें समझना बहुत ज़रूरी है कि नाउ अ डेज द यूज़ ऑफ दीज ट्रेडिशनल मेडिसिन इज़ बिन अक्रॉस द वर्ल्ड। जो अलग अलग डेवलपिंग इकॉनमीज़ हैं, जैसे एशिया हो गया, अफ्रीका हो गया, लैटिन अमेरिका हो गया, और धीरे धीरे इट हैज़ बीन ऑल्सो रैपिडली इंक्रीजिंग इन द मार्केट्स ऑफ नॉर्थ अमेरिका एंड यूरोप। ओके, एंड इसका एक ज्वलंत एग्जाम्पल ये है कि लाइव एग्जाम्पल ये है कि इन द ईयर 2014, ओके, देयर वाज अ 60 ऑन द 67th वर्ल्ड हेल्थ असेंबली जब हुआ, तो वहाँ पे देयर हैज़ बीन अ रेजोल्यूशन विच इज़ नोन एज द 67th वर्ल्ड हेल्थ असेंबली रेजोल्यूशन, विच वाज बेसिकली डन ऑन ट्रेडिशनल मेडिसिन स्ट्रैटेजी with the objectives to harness its contribution and promote effective use। तो ये बहुत एक इम्पॉर्टेंट एस्पेक्ट है कि वर्ल्ड हेल्थ ऑर्गेनाइजेशन इसको रिकॉग्नाइज करती है कि अक्रॉस द सोसाइटीज इट इज एवरी पैथी हैज इट्स ओन बेनिफिट्स। सो व्हाई नॉट टू इंटीग्रेट इनटू द सोसाइटीज एंड मेक इट इज अ यूजफुल वन। So you can see, like, among all the international developments and particularly of India, we have a pluralistic medical culture where we have a well documented history and practice of alternative system of medicine. इसको alternative system of medicine भी बोला जाता है, जिसमें बेसिकली आयुष आ जाता है। और आयुष के अंदर जैसे हमने कहा, यस यू कैन सी फ्रॉम द स्लाइड कि इसमें योगा, आयुर्वेदा, योगा, यूनानी सिद्ध एंड होम्योपैथी। सो लेट अस टॉक अबाउट आयुर्वेदा नाउ। आयुर्वेदा एज यू ऑल नो दैट इज अराउंड 5000 ईयर्स ओल्ड, ओके। और चरक संहिता और बेसिकली आपका सुश्रुत संहिता के से ये सारा का सारा एक कॉम्पेंडिया, मतलब ये सारा का सारा एक कॉम्प्रिहेंसिव एस्पेक्ट लिया गया। और अगर आप आयुर्वेदा के अगर 5 तत्वों की आयुर्वेदा के अंदर बात बोली गई है, जिसमें आपका पृथ्वी दैट इज अर्थ, जल मतलब वाटर, ओके, देन अग्नि मीन्स फायर, वायु मीन्स एयर एंड आकाश मीन्स ईथर। सो इनसे मतलब कोई भी बॉडी का कंपोनेंट बनता है। सो आयुर्वेदिक वैल्यूज़ ने ये बोला कि इसमें जितना भी दोष होता है, ओके, जो जितना भी मतलब जो बीमारियां होती हैं, ये इन्हीं में से इनका कॉम्बिनेशन, जैसे यू कैन सी फ्रॉम द स्लाइड कि त्रिदोष का मतलब त्रिदोषवत का मतलब होता है जब ईथर दैट मीन्स आकाश और एयर का कॉम्बिनेशन हो, तो उस तरीके का। अगर कोई पित्त से रिलेटेड डिजीज हो, वहाँ पे फायर का कंपोनेंट आ जाता है जिसमें अग्नि। और जब कफ की बात करते हैं तो अर्थ एंड वाटर को मिला के हमने बोला गया। तो इसमें बेसिकली देर आर 3 फिजियोलॉजिकल एंटिटीज इन लिविंग बीइंग विच इज रिस्पॉन्सिबल फॉर द ऑल द मेटाबॉलिक फंक्शन। और इसमें अगर कोई विकार आ जाए तो बेसिकली वो बेसिकली आयुर्वेद का बैकग्राउंड है। और सिमिलरली जब हमने देखा कि यहाँ पे मेंटल कैरेक्टरिस्टिक्स की बात जब करते हैं तो उसमें सत्व, रजस और तमस, है ना, 3 त्रिगुण की बात की जाती है आयुर्वेदा के अंदर। सो इन टोटलिटी यू कैन सी कि जब भी इसमें कहीं ना कहीं इसमें कहीं ना कहीं अगर कुछ एक विकार आ जाता है, देयर इज एन इशू इन ऑल दीज system of medicine or in the body, so it will be classified as a disease, okay. Then similarly you can see in the slide the preventive aspect of Ayurveda is called known as श्वात वृत्त, जिसके अंदर बेसिकली आपका पर्सनल हाइजीन, आपका रीजनल रिजीम्स, आपका सोशल बिहेवियर, द यूज ऑफ मटीरियल्स एज वेल एज प्रैक्टिसेस फॉर हेल्दी एजिंग के सारे कंपोनेंट्स आ जाते हैं। एज फार एज द ट्रीटमेंट पार्ट इज कंसर्न, इट कंप्राइजेस ऑफ द ड्रग्स विच इज नोन एज औषधि, ओके, आहार दैट इज डाइट, and vihar that means your lifestyle. So it is a holistic approach rather than a a particular aspect. So it's a way of living, okay. And similarly ayurveda basically uses the plants as a raw material for the manufacturing of the drugs, as you all know, and through the materials of animal and marine origin as well as metals and the minerals, okay. And it has specifically spoken about the do's and don'ts according to the various diseases. और अगर हम इसमें थेरेपीज़ की बात करते हैं, आप एज यू ऑल नो दैट केरला इज़ वेरी वेरी पॉपुलर, ओके, एज फार एज द आयुर्वेदिक सिस्टम ऑफ मेडिसिन इज़ कंसर्न। सो और आपको पता है कि इंडियन बॉडी में द सेंट्रल काउंसिल फॉर इंडियन सिस्टम ऑफ मेडिसिन दिस इज ऑल्सो प्रमोटिंग आयुर्वेदा इन अ बिग वे। तो अगर यहाँ पे पंचकर्मा थेरेपी की हम बात करते हैं तो ओवर द इयर्स शर, सूत्र और जो पंचकर्मा है, ये 2 मेन फॉर्म्स ऑफ थेरेपी है। पंचकर्मा में बेसिकली 5 डिटॉक्सिफिकेशन प्रोसेसेस यूज़ की जाती हैं इन ऑर्डर टू ट्रीट एनी डिजीजेस, ओके, जिसमें वाम, विरेचना, बस्ती, नस्या एंड रक्त मोक्षा, ओके। सो दीज आर द, सो यू कैन सी फ्रॉम द स्लाइड। तो मेडिकेटेड एमेसिस का मतलब होता है वॉमिटिंग करना, एमेसिस मीन्स वॉमिटिंग, ओके, जैसा, तो वो उससे शरीर से आपका निकाल देता है। सिमिलरली प्यूरिफिकेशन अनीमा दिया जाता है, मेडिकेशन विच कैन बी गिवन फ्रॉम द नोज एंड ब्लड लेटिंग, जहाँ पे रक्त को शरीर से निकाला जाता है। सो यू कैन सी एंड व्हेन यू टॉक्ड अबाउट शर सूत्र, इट इज़ बेसिकली अ पैरासर्जिकल इंटरवेंशन जहाँ पे एल्कलाइन थ्रेड को क्वार्टराइजेशन के लिए यूज़ किया जाता है, एंड इट इज़ अ साइंटिफिकली वैलिडेटेड थ्योरी, जहाँ पे आपको बेसिकली एनल फिस्टुला, पाइल्स वगैरह के केसेस में इसका बहुत यूज़ होता है। देन वी कम टू द सेकेंड पार्ट दैट इज़ द यूनानी। यूनानी as basically has its origin from Greece and was laid by Hippocrates। और ये देखा गया कि 11th सेंचुरी में अरब्स और पर्शियन टाइम में ये सब यूज़ होता था। और इंडिया में पर्टिकुलरली 13th सेंचुरी से 17th सेंचुरी जब मुगल्स का पीरियड था, उस टाइम पे Unani was practiced a lot and it was very famous. और यहाँ पे भी अगर जिस तरीके से आयुर्वेदा है वो यहाँ पे भी सेम आपके बॉडी के अलग अलग, जिसमें जिसको अरबिक या पर्शियन वे में बोला गया, जिसमें अर्कन मीन्स एलिमेंट्स, मिजाज आदमी का जो नेचर होता है, टेम्परामेंट, देन अखलात ह्यूमर, ऑर्गन्स मीन्स आज, and then your arwa means spirits, and क्यूआ मीन्स एनर्जी, जैसे आपका चाइनीज मेडिसिन में काई को एनर्जी का फॉर्म बोला गया है, एंड देन अफाल मीन्स फंक्शन को कंपोजिट वे में इसको समझाया गया, तो दैट मीन्स इट कंप्राइज ऑफ योर सेवन components. So from here we come to the second part. जब आप योग की बात करते हैं, ओके, देन यूनानी के बाद में, सॉरी, हम पहले सिद्धा को समझ लेते हैं. सिद्धा भी द्रविडियन कल्चर का पार्ट है जो इंडिया के अंदर आया, और बेसिकली सिद्धा के अंदर इसका जो मौलिक रूप से उसका जो मतलब होता है, दैट मीन्स अचीवमेंट. एंड सिद्धार्थ्स वर द पीपल who had got achievements or have got results in medicine, so that's why it was known as Siddha. And it also emphasized on the patient, their environment, their age, their gender, their race, the habits, the mental framework, physical condition, all everything. Similarly, the diagnosis of disease within Siddha is done through examination of the pulse, urine, eyes, study of the voice, color of the body, tongue, status. Okay, so all these things have been integrated. और यहाँ पे we have been seeing that Siddha has got very good treatment for various ailments such as psoriasis, rheumatic disorders, and even now you can see, because these are all considered to be palliative in nature as far as modern medicine is concerned. That means modern medicine don't have full-fledged treatment for all these things, and henceforth it has to be managed. It has to be, that's why it's called palliative in nature. Whereas Siddha, in forms of it has got very good results in rheumatic disorders, for chronic liver disorders, benign prostate hypertrophy, this is also known as BPH, and then piles and dermatological disorders of non-psoriatic nature. Similarly, as you know, like yoga now has become very very popular, and India is the brand ambassador of yoga, and Baba Ramdev has propagated yoga in a big way. And see, it has come from the Sanskrit word yuj, that means to unite. So that's the unification where the mind and the soul and the body all are united together. And again, it has got various components where we have to restrain, observance, physical posture, which is known as asana, pranayam. It is also in yoga can be correlated with physiotherapy in terms of your diaphragmatic breathing in can be used as a form of a yoga. Similarly, that then restraining of the sense organs, then you have to do contemplation, you have to do meditate, and you have to deep meditate. So these are the various components within yoga, and it has a very very important effect on the various ailments, and particularly the psychosomatic diseases, and improves the individual resistance and the ability. Then you have got naturopathy, and naturopathy again, it is basically assimilating all the things, and it uses various form of physical agents such as fasting, baths, hydrotherapy, body packs, okay, underwater exercises, magnet therapy, chromotherapy, acupuncture, acupressure. See, these components are also integrated within physiotherapy, which is used basically by the Western world, and in India it is known as the Indian system of medicine. Similarly, you have and then you have got your homeopathy, and like homeopathy has been very very in three states, particularly your Chhattisgarh, the Kerala and Bengal is very very famous in homeopathy. Particularly Kerala is famous for AYUSH, particularly the Ayurveda, whereas Bengal is very famous for homeopathy. And again, in homeopathy is based on the assumption that the causation of the disease mainly depends upon the susceptibility of the proneness of an individual to the incidence of a particular disease, in addition to the external factors. So that's why all these disease, the medicines in homeopathy, they are made from the natural substances, that is the plant products, animals, or the animal sources, and it has own areas of strength in therapeutics, and it is particularly useful in treatment where there is allergies, there is autoimmune disorders, and the viral infections. Okay, and now even some of the studies have reported that it has got very effective treatment or preventive treatment for your COVID-19. Similarly, there are other gynecological, surgical, pediatric conditions, where homeopathic treatment is very good. And similarly, behavioral disorders, neurological disorders, and some of the metabolic disorders are also treated very successfully. So the entire component, when you integrate together, you will see that all these system of medicine are being integrated together in 1995, and later in the year 2003, a department, previously it was known as Department of Indigenous System of Medicine and Homeopathy, and later it was renamed as Ayush in November 2003. And what are the main objectives? Their main objective is to upgrade the education standards in the Indian system of medicine, to strengthen the existing research institutions. That's why, you have got All India Institute of Ayurveda in Delhi, in South Delhi as well, where research is being promoted along the other institutions of repute. Similarly, it is using various schemes for promotion, cultivation, as well as it is being integrated with the primary healthcare system, so that awareness can be created and the benefits of indigenous system of medicine can be integrated with the modern medicine treatment. And similarly, see, as far as the bodies are concerned, we all know, like we have got a central council for Indian medicine, we have got central council for homeopathy, and there are various research council for Ayurveda, Siddha, Unani, Yoga, and Naturopathy. But see, there are certain hindrances as well. Now, what are the hindrances? You need to understand. One of the hindrances, there is a prejudiced approach. Prejudice means bhedbhav hota hai, like, curbing the state patronage or abolition of the ISM schools and creation of the medical bureaucracy. Bureaucracy plays a very, very important role, because previously what happened is all those centers, they were more occupied by people who are from the modern medicine category, and that's why there was always a tussle, like which field is much better and how it could be utilized. And you can see from this slide, infrastructure under Ayush, like, the hospitals, how many Ayurvedic hospitals are there, how many Unani hospitals are there, okay, what is the number of beds, how many number of dispensaries. And according to some research statistics, they have said around 6 to 7% of the people uses Ayush in India, whereas according to the various states, it varies from 15 to 17%, okay. And similarly, it has been also been seen, like, the potential of indigenous system of medicine has also been curbed by the perils of your caste, class, communal, language based politics. And then there is a strong epistemological preferences within the ISM system, because which undermines its scope as well as its expansion. So it has to be actually, reframed in a new manner, so that, because if you see the history, right from the beginning, Mudaliar committee, and then followed by your national health policy in year 1983, followed by your national education policy in 1989, in 2002, everybody has actually, promoted modern system of medicine, and they have said, like, there are more schools have to be created, the curriculum has to be standardized, the drug research has to be done. And that's why, Ayush had and then it is being integrated within National Rural Health Mission in the year 2005. And Department of Ayush also, in its 12th plan, with an objective to provide affordable, sustainable, and accessible care. So all these things have been implemented. Now, like I said, some researchers has been there where they said, like, the overall, what are the socio-economic pattern in India which uses these modern system of this system of Ayush system of medicine. So, the government has also proposed to create a rural medicine doctors, and to create a public health cadre which are utilizing all these facilities. And then under the various schemes such as the Janani Suraksha Yojana, these things have been integrated. Public health has integrated the use of modern medicine and Ayush in a big manner, and it is utilizing the services of the Ayush doctors to cater to the health needs of the country. And similarly, there have been other programs such as the MMR, IMR, TFR, then malnutrition, anemia, even some programs particularly in northeast eastern states, it has been seen, particularly in Arunachal Pradesh, okay. And then your Mizoram, Meghalaya, Ayush care utilization has increased, okay. But as far as the overall context is seen, when we compare the private with the public, private dominance is more like, in India there have been a chain of private health clinics like the Bakeson's Homeopathy. Okay, so these are very very popular, or Dr. Batra's Homeopathy. It's a chain of good homeopathic clinics. Similarly, your Jiva Ayurveda is very famous. So likewise, the private has its own share of giving Ayush care within India. And there are certain international brands such as like Dr. Isaac Mathai, who is very very famous, and it has made Ayush as an international brand. So we need to take up the good features from the various aspects so that it can be integrated into one. It has to be seen that there are the where Ayush services have been very very effective. For example, like Ayush services have been effective in treating skin related or musculoskeletal related ailments. And still the potential has not been surged very effectively in chronic diseases. So you can see from the slide the objectives for which the Central Council for this alternative system of medicine, or Ayush, has been formed. So their aim is to produce high quality scientific research, teaching and training. Collaborative consortia has to be created so that various stakeholders can be invited, more integration could be done, more collaborative work can be done, and things also need to be changed at the policy analysis, advocacy, and the translation level. So in the world, you see, China has effectively augmented human resources for traditional medicine, as well as effectively integrated this conventional medicine at every tier of their healthcare system. And same like India can also do a lot of these things. It can take cues from the Chinese model. And as we know, like pluralistic form of medicine is now the emerging trend, where allopathic and the other system run parallelly, and it can be integrated, it can be institutionalized in such a manner in a national policy level that it brings benefits. So thank you so much for your patient hearing, and we will be coming back with new videos